Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752. And when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has loads of scientific studies, and the foreword is written by the lovely Suzanne Summers. She just put you in her latest book, too, didn't she?
She did. She's amazing. And what she does is, I think, how many books, Nita? 18 or so she's done on medicine?
Oh, a lot.
Yeah. And she interviews the latest types of natural medicine, and she interviews the doctors that do these. And the thing I love about it is what she does is lists kind of the things that they do, so you can do a lot of it on your own without even seeing a doctor. They're actual interviews, and the one with me, I think was, I don't remember, 19 pages or so about regenerative medicine, which I've done on her body and her son Bruce, who is an avid bicyclist who really got racked up a lot of times. And it was kind of interesting. Bruce and I and Bruce's family lived next door to each other years ago, and he would knock on the door all beat up from falling off a bike or whatever, and I would inject him laying on the floor of my house.
Oh my goodness.
Yeah, many, many times. And I always carry my injectables with me in case someone needs help. Years ago, when I was taking golf lessons a lot, people would line up to get injected. And, golfers get injured quite a bit. I think, honestly, more than any other type of sport, I think I get more golfers than anything else. And a lot of people think golf is not a sport. Try it. It is disastrous on the body. It really is. Every single joint in the body gets beaten up with repetitive golf. Going to the range, people are sometimes at the range for hours and hours, hitting on hard mats and things like that. And I'm one of them. Let's go to Bob. Bob, how are you? He's got a hip issue. This is Dr. Marc Darrow. Bob, how are you today?
I'm okay, I believe, but I've got a question. I fell and broke the ball off in my hip.
Yep.
So they did a hip surgery and replaced the ball.
Okay.
And I'm having a heck of a time getting where I can put weight back. It's on my left side.
Okay.
When I try to walk with my right foot, it feels like it's giving out on me.
Okay.
It's been about 6 months.
Okay. Well, you're still in the healing stage, number one, so that's the good news. After a surgery, it takes typically about a year for things to kind of balance out and for the tissue to remodel. Is there a leg length discrepancy, do you know? Did one leg turn out longer?
Yes, I do have. One leg is probably a half inch shorter than the other one.
And is that from the surgery, do you know?
No, it was prior to that.
Is that because a chiropractor told you that, or is that because your surgeon told you that, or what?
Well, a chiropractor told me that. He measured my, I guess, from the hip down.
Sure.
25 years ago, and told me I had one leg shorter than the other one.
Okay. So let me just tell you my experience about that, number one. The most important thing is I love chiropractors. So when I talk about that, nothing I'm saying is negative. But I do find that they tell everybody that they have a discrepancy between one leg and the other, including me. Okay, but I don't have trouble walking. And, it's just a thing that they're trained in. But my experience is everybody has a leg length discrepancy, and it's not an issue. Okay, so let's get that out of the way. So when we are born, we're just a couple of cells big, right? Or actually, when we're born, there's more, but when we're initially created into the embryo, there's not a lot of cells, and they keep dividing. Well, they don't divide evenly on both sides of the body. And even identical twins end up looking different over the years. And so what happens is this. Have you ever seen pictures of faces that are cut in half in a photograph?
No,
it doesn't even look like the same person in most of them. Some people have identical, but most do not. And that's what this leg length discrepancy thing is. So I'm not worried about that. What I am curious about, though, is if you have a leg length discrepancy because of the hip replacement.
No, I was told that I had this, and when I do physical therapy, I notice that when I'm standing, I'm moving the foot back and forth to do exercises. One side I can do it easily, the other side it drags on the ground.
Yeah. Okay. Well, the only way you'll know if you have a leg length discrepancy right now is with an X-ray. Okay? And then it can be measured. It's not something you just notice unless it's 6 inches shorter.
One thing I was wondering about, when they do this surgery, they have to cut muscles to get in there. What do they do about the ligaments? Do they just stretch them to put that ball in there, or what do they do?
It depends on the type of surgery that's being done, so I don't have an answer for you, but typically, yes.
Yes.
Yes, everything's stretched out. Yeah.
What they did, I guess, was cut the end of the femur off and put a post down in there with a ball on it.
They put a prosthesis in. Yeah. Now that's something that has to be done. If you have a fracture and you can't place it back together, you need a prosthesis. But I see way too many people get these surgeries done that, number one, didn't need them. I don't know if you heard the first half of the show.
Yes.
But there was a young gentleman who came in ready for a hip replacement to get what you had done when it wasn't even the right area causing the pain.
Okay.
That's disastrous.
What you're telling me is I just have to keep doing the physical therapy, and
yes,
and time will put everything back where it should be.
Yes. I mean, there is a possibility that I could help you. I'd have to touch the area and see where your discomfort is coming from. It may be something really unrelated to your hip replacement. Now, here's another thing people don't know. When people have surgery, they're unconscious. And a lot of people get injured during surgery because you're like a big bag of potatoes getting dragged around. I have people that get shoulder injuries when their knee is getting operated on. So I'm not saying that happens to everybody. It doesn't, but it does happen enough that I've had many patients come in complaining of that. They go, after surgery, I'm worse than I was before in a different area that I never had a problem with.
Is age a big factor? I'm 85.
I'm sorry, I didn't hear that.
Is age a big factor in this because I'm 85?
Not really. 85 is pretty good these days. 85, 100 years ago, you wouldn't be here. But I get a lot of people I treat who are 85 years old or older, who are in better shape than most people on the planet. So it all depends.
I'm just not going to give up. I'm going to keep doing the physical therapy.
Well, I agree. You just keep doing physical therapy, and physical therapy can be a miracle for you. But I would love to have you pop in the office sometime. You don't even need an appointment. Just pop in, say you're the guy I talked to on the radio, and you want me to just check in 2 minutes and see if it really isn't the hip joint that's bothering you. It might be the muscle. It may be the greater trochanter where the tendon's attached to from the muscles. There are actually 14 muscle attachments on the lateral side of the femur. There's a lot going on there. And
And
so
it feels like when I step with my right foot, putting the weight on the left side of the surgery, it just feels like it's giving out on me.
Yeah.
There's no pain. It just feels like it's not going to do anything.
Well, that's another issue because the subconscious blocks activity. when there is pain. And it may be just like a PTSD in your hip. I know that sounds weird because it's a psychological term. But you may have come out of that surgery guarding, protecting. I need to see you. It's just that simple.
Okay.
If you want to call the office, it's 800-300-9300. You can call there now. There's people that are hanging out. And if they're busy, leave a message and they'll get right back to you, okay? That's 800-300-9300. I'm hoping, Bob, that your case is not something directly from the surgery, that the surgery came out perfect, and that it's something else that is sort of a side effect of the surgery.
Okay. Thank you.
Yeah, God bless you, man. And the last thing I'm going to say about it is I get a lot of people who come in who've had joint replacements, knee or hip, ankle, whatever, and then they have back pain afterwards, never had back pain before because the integrity of the anatomy has been disrupted. So, I'm going to say this the rest of my life. I've been saying it for 25 years. Don't get a surgery unless you have to. And in your case, Bob, you had to.
I had to, yes.
Yeah, so God bless you. You get a fracture like that, and they can't just pin it back together, which apparently they couldn't in yours. A lot of those they can just pin back together, put some metal around it, and save having to put prosthesis in there. I don't like prostheses for a lot of reasons. One is they can gather bacteria. And it doesn't happen often, but it can happen. And it's a more invasive surgery to put a prosthesis in than just drill in and put some pins in there.
You never know because you're out, and you never know how much of it broke off. So they don't give it to you and say, "Here's your bone." So
yeah, I'm going to make the assumption they did an amazing job, and you had to have it done. And now your job is to work it and to follow the physical therapy. How often are you getting physical therapy?
Twice a week.
Yeah, I think that's good. 2 or 3 times a week, and I think that thing will start loosening up on you, and they'll get you back in shape. God bless you, Bob.
Yeah.
And
God bless you, and thank you very much.
My prayers are for your complete healing.
Thank you. That's the only thing that'll do it. Thank you very much.
Yeah, thank you.
Bye-bye.
Thank you for your call, Bob. And our number right here in the studio is 866-870-5752. Call right now. Get your free book, Dr. Darrow's latest. Stem Cell and Platelet Therapy is the title. Regenerate, Don't Operate is the subtitle. It has over 264 scientific studies, you should know. I counted. And the foreword is written by the lovely Suzanne Summers.
Suzanne Summers, I love you. She is a great woman. Boy, she got energy. Amazing. You know what I like best about her? When she's speaking, she's doing a speaking engagement, and all the guys glom around her because she's so good looking. First thing she talks about is her husband, Alan Hamill, to make sure everybody knows she's in love with her husband. Don't hit on me.
And they're together forever.
Yeah, they've been together forever, and they're going to be forever. Okay, so I have another question here till we get some callers in. Don't be shy. Call me, 866-870-5752. I'd love to talk to you. So here is a question. Been medically diagnosed with osteoarthritis and my left knee. Have some pain, notable loss of function in the knee. Been both physically demanding job, lifestyle, which are both centered around high-level athletics. Good for you. I would like to set up an appointment with you, hopefully as soon as you're available. My number one question is, how long will the treatment sideline me for work, as I can't really take much time off? I'm 55, not overweight, and want to get back to sports. I live right here in L.A. So a lot of good information in that, a lot of good questions. So I'm glad the person lives in L.A. because it's easy to access me. I'm right at the 405 freeway across it from UCLA on Wilshire Boulevard, about 20 minutes from the airport, LAX. And we have people fly in all the time from all over the world, actually, to get treatment. Some people come in once a year, for a tune-up, and they get to vacation in the sunshine. And typically they'll stay at the beach at Shutters or something like that. and have a really good time while they're getting their treatments. So sometimes it takes a few treatments. Sometimes people fly in for a week or so, and I'll do several treatments during that week. Typically, it's going to be one treatment every couple of weeks if you're local like this person is. So how long will the treatment sideline that person from work? That's a big, big question for people. It doesn't have to, and everybody is different. I like people to chill after their treatment if they can, but some people can't. So you do what you got to do. Everybody is not going to follow my directions perfectly, but it's still better to get the tissue growth started whenever you can. So a lot of times people are going out of the country for a trip or something, and they go, I'll wait a few months till I get back. Well, why? You can get one treatment at least before you leave and get the tissue growing and start the healing. And then when you get back, you can finish it off. So my point of view on treatment is do it as quickly as you can, and do whatever you need to do. There's some people that have many steps up to their house or their apartment, and there's just no way to get around it. Some people who are very, very focused and who are so sick and tired of feeling pain will actually move to someone else's house without stairs, or they will put a futon on the first level of their house if their bedroom is upstairs. I had one person who had their shower upstairs. It was a knee problem, and they actually went to their gym to take a shower because there were no stairs there. So it's up to the individual, and one size does not fit all. But my point of view is get the treatment done when you can. You know, I confess to a lot of my patients, I have injected myself and gone out and done sports the same day. For me, it's not a big deal because the next day I can inject myself again. You know, I'm very fortunate to be an athlete who works in the field of healing to be able to heal myself. I inject myself whenever I have an injury. But other people are not going to be in that situation, so it's going to be up to you to do it the way you want to do it. Let me see if there's anything else around this. The fact the person is a high-level athlete is very good. They usually heal real fast because they want to get back at it, and they're going to take care of themselves. Need anything else from you here before I move on?
Well, we still have time. You can call and speak directly to Dr. Darrow right here, right now in the studio at 866-870-5752. That's 866-870-5752. And I really urge you to do so because he might try and tell me another joke.
Now you're making me laugh. Can I hit you up with one more? Can you take it?
Yeah, of course.
Can you handle it?
It's my favorite thing.
Okay. What does corn say when it gets a compliment?
Chowder.
Aw, shucks.
Okay. Yellow is my favorite color.
All right, one more, then we'll get a question. Why did the robber jump in the tub?
To hide the money.
No, he wanted a clean getaway.
Oh, I like that one.
Nita, you're in trouble. I've got hundreds of more waiting for you.
Oh, come on, audience. Please call Dr. Darrow. I know that 30 to 40% of Americans are in chronic musculoskeletal pain. So it just takes one of you to call. Just one. 866-870-5752. 866-870-5752.
Oh, you got a caller out of that. Someone's calling in.
Oh, thank you.
They wanted to take Nita off the rack.
Oh, gosh. Thank you. Thank you. My arms are killing me.
I'm going to get a quick question in here before...
Okay.
Before this patient gives all their, or this person gives all their information to the call screener. This one says middle finger, let's see, middle finger of my right hand is very stiff. Yeah, that's a common one. It could be a trigger finger. You've heard of those, where the tendon that goes through the A1 pulley gets stuck. It could be osteoarthritis. It could be psoriatic arthritis, a lot of types of arthritis. It could be just overuse, too much golf, too much hammering. I have to examine it, take a look at it, and let you know the answer to that. I do fingers almost every single day. We use a teeny little needle to inject them. We use an icy spray so you don't feel it as much. And fingers seem to do very well, even with pretty advanced arthritis where people come in and they've got these huge nodules on their fingers. So, I do wrist, fingers, elbows, you name it. Not just the shoulders, the knees and the hips, neck, all the way from the back of the head for headaches down to the bottom of the feet. Let's go to Jan. Jan, Dr. Marc Darrow, your daughter's knee. Talk about it. What happened?
Hello?
She had an injury. Yeah.
Hello?
Hello?
Can you hear us, Jan?
Okay. Can you hear me?
Oh, yeah.
Yeah, we hear you fine.
Okay. 8 years ago, she jumped over a small fence, and she tore, was it the cruciating ligament behind the knee?
Yeah, there's two cruciate ligaments, the anterior and posterior.
Right. I don't know which one it was, but she tore that. And then she went for consultation, and they did do a meniscus repair.
Okay.
But she said that her knee always kind of, gets out of place.
Yep.
She's 50 years old.
Okay.
And he said that they looked at the other knee, and they said she has osteoarthritis and like bone on bone.
Okay. Now, is that the knee that she injured long ago jumping over the fence? Or is that the other one?
On both knees she has.
Both knees. Okay. So she has
that.
arthritis in both knees.
And she kind of manages it. So I don't know.
Okay. Well, let me give you a little bit of feedback right now. How long ago was her first surgery?
8 years ago.
Okay. Some doctors do something called a lateral release, where they cut the fascia, which is collagen, that holds the patella, which is the front part of the knee bone, in place. And when that happens, the knee will sublux. It'll move out of place. You said that she has her knee going out of place.
Right.
And that's probably what happened. It's a surgery that I've never once seen work, but they're still doing them. And my wife, unfortunately, had it done when she played soccer as a teenager, and she still has that knee slip out once in a while now. Mm-hmm. When it slips out real far, she's got to slam it back in place.
Yeah, that's what she has to do.
Yeah, and it's excruciating. So I've injected my wife's knee. That hasn't happened since. Okay? Mm-hmm. And there's a good hope we can regrow part of that retinaculum around the patella. Retinaculum is just this fascial tissue that holds it in place and keep it from subluxing or dislocating again. As to the bone on bone, that's a word that's used to get you to have a surgery. I don't believe in it. Mm-hmm. It's rare. I see it. And I think there's good hope for your daughter getting platelets and stem cells and healing up her knees. She may not come out perfect, mm-hmm. but the hope is that she'll get a lot better than she is right now.
So that she does function, but it varies from week to week, day to day.
Yeah. And this is not bashing the surgeons. I just find that after a surgery, it's much harder to heal a part of the body because tissue has been removed and the integrity of the anatomy
it was
is
unfortunate that she tried to take a shortcut and then she...
Oh, sorry to cut you off, Jan.
Jan, go to the website. Go to the website, www.lastemcells.com. You can email me there, and you can call the office at 800-300-9300. Thank you, Nita Valens. You're a great host. Thank you, Suzette and Alex and the rest of the staff. God bless you all. Thank you for listening.
Thank you. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.